Hi everyone, I'm Spencer Romine. I'm a sports medicine physician at the Orthopedic Institute of Western Kentucky. Today we're going to be talking about rotator cuff tears. Rotator cuffs are made up of 4 tendons, and obviously from an anatomy standpoint, we all have a ball and a socket joint, our collarbone, and then our shoulder blade that goes to the back. The rotator cuff, made up of 4 tendons, has 3 tendons that come over and they grab the side of the ball. The 4th tendon lives in the front of your shoulder. The most common tears that we see in rotator cuffs are generally the top tendons, and of those 3, the front tendon is generally the one that tears loose. So what kind of symptoms would be associated with the tear of the rotator cuff in the top of the shoulder? Most commonly, pain at nighttime, weakness with elevating the arm overhead, pain especially with reaching for objects, and those are oftentimes associated with some type of trauma, whether that be a fall from just on ice or off a ladder or whatever it may be. And then some people will have a degenerative tear, meaning over time they may have a spur underneath their shoulder blade that rubs on their rotator cuff. If you elevate your shoulder in space, that spur may rub the rotator cuff to a point where it tears. So when people come to see us for rotator cuff injuries, treatment varies depending on what the size of the rotator cuff is in terms of its tear and what they've done for it. So oftentimes if it leads to surgery, the repair isn't something that you look at and go, wow, I had no idea, but instead it's not rocket science. We're taking the tendon and we're pulling it back down to the bone where it belongs, and we're anchoring it in place. That oftentimes requires physical therapy afterwards. It can be a long process. The process primarily involves healing of your rotator cuff. And in the meantime, we're trying to work on range of motion not to get a stiff shoulder. So it can be a 3-month process. Oftentimes people don't want to do surgery, and what other options do you have? The other options are injections in your shoulder along with physical therapy to try to strengthen all the other muscles about the shoulder. When that fails, rotator cuff surgery is the option of choice.